So if you are watching this video, you are likely someone that had what was supposed to be a relatively simple vasectomy procedure that now has turned into a little bit of a nightmare because now you're starting to experience pain when you potentially didn't have pain before. So if this is you, then please watch this video because a lot of this might make sense for some of you. I'm Hina. I'm an orthopedic and pelvic floor therapist. I've had 25 years of clinical experience, and our clinic here in Philadelphia, we've been working on patients with chronic orthopedic as well as pelvic pain in both men and women for over 15 years. So let's get back to you've had a vasectomy. It was supposed to be really simple recovery, and now you're starting to develop pain in and around maybe the testicular area, the scrotal area, the perineum. Perhaps you're even experiencing pain deeper within the rectum, potentially the tailbone, behind the prostate. And what this is called is basically pelvic pain. So you have developed chronic pelvic pain post-vasectomy. So in order for me to basically explain what might be happening to some of you, and this may not be all of you, but what we have seen, because we treat a lot of this in our clinic, is that oftentimes this is actually partly a muscular issue. Now, what I mean by this, I have to explain the anatomy, is that you have a group of muscles within your pelvis known as your pelvic floor muscles. These muscles you can see here in red are inside of the pelvis. Now the pelvis, basically this is the spine, these are the love handles, this is the pubic bone, is like this round structure that kind of forms this bowl. And inside of that bowl is where these 14 muscles of the pelvic floor kind of live. And they give function to your bladder, to your rectum, as well as to your sexual organs. So if we look at this photo right here, here's a simple kind of depiction of what the pelvic floor is. It's indicated by this red line over here. It connects from the tailbone to your pubic bone. You can see here on the underneath side, it connects kind of to the front of the pubic bone, right over here to the tailbone, but it also is on both sides of your sit bones. Now I know this is a female model, but just imagine there's a penis here because all the muscles are pretty much the same. And so if we look at this, you can see that these muscles go through, again, this is a female, but don't worry, you don't have the uterus. You can see it goes through the bladder and the rectum. Now, when these muscles are basically become tight, and these muscles can become tight for a whole host of reasons, and we'll talk about them later. But when these muscles become tight, you can see that if there is tightness, because it goes through kind of the sexual organs as well as the bladder and the rectum, that any of those muscles can actually be affected. Now, when you have any type of surgery down in the perineal area, so even with a vasectomy, for some of you, this can actually create scar tissue as well as possibly tensioning within these pelvic floor muscles. Now, like I said, it may not happen to all of you, but for some of you, and I do a lot of consultations with men from all around the world, when I really dive into their history, what I typically end up finding is that, they actually had pelvic floor muscle tightness before they even had the vasectomy surgery. And for some of you, that may have shown up like, okay, yeah, I feel some tightness or like a golf ball sensation in the back of my prostate or in the rectum or in the perineum. There was always something that was tight, or perhaps it was like tailbone pain or some hip pain that you didn't relate as a pelvic floor problem. But now when you have surgery, which the brain perceives almost as a trauma or a little bit of a threat, I would say, to the body, like it needs to perform a protective response because this is something invasive to the body, then your brain can actually end up turning on these muscles even more. So if you had tightness before, which can happen for a lot of different reasons, which we'll talk about, if you had tightness before, then perhaps because of this surgery, your body perceived this as, oh my gosh, I need to protect this area, something bad happened, and so let's tighten up all of these muscles. So now these muscles have become tight, and when these muscles become tight, they form little spasms or bands known as trigger points. Trigger points are basically like knots or bands within a muscle, and they can develop in any muscle within the body. A common one is, let's say, your upper trap. If you press on this muscle, chances are for many of you, you have like a knot in your upper trap. And when you press on it, it's very tender, or it's so tender that it can actually create referred pain. And if you rub it, it tends to feel a little bit better. So the same thing can happen within these muscles of the pelvic floor. And if that happens, it can give you all of these symptoms such as testicular pain, scrotal pain, penile pain, perineal pain, and like I said, all the other ones that I talked about, low back and tailbone and hip and all that kind of stuff. So if this is starting to resonate with you and it's starting to make sense, then let's chat a little bit about why this may have happened. So there can be a lot of different reasons why tension in your pelvic floor may have developed before you even had the vasectomy surgery. Some of these things can be just postural changes that happen within your body. Now, everyone's posture is just a little bit off, but some of you guys have significant postural changes. When you have postural changes, your body kind of gets out of alignment. When you are out of alignment, think about all the muscles that actually connect to your body, and especially around the pelvis. So if we look at this picture, you can see that there's a ton of muscles that go through the spine, in and around the pelvis. This is the pelvis right here. There's a lot of attachments through the pelvis, on the pelvis, to the spine, and to the hip. And even through the backside, you can see here that there's lots of muscles that attach in and around the back, around the hip, and into the pelvis. And actually 2 of these muscles within the pelvic floor are actually attached to the hip. So you can see if there's imbalances within the body, it can actually end up creating tension and weaknesses in a variety of different muscles in various areas from side to side of the body. So if there's tensioning within here, it can actually create tensioning within the pelvic floor. And when that happens, that can end up contributing to the pain that you're feeling. So one of them is postural changes. Now, why do postural changes happen? For a number of different reasons. You can have, sports injuries that change things. You can, with time, perhaps you were in a car accident, perhaps you had a gym injury, or for many of us, we sit all day long. And so when you sit all day long, you're also sitting on these pelvic floor muscles, but you are also creating a lot of tightness within like the hip and the deeper hip flexor muscles when you're sitting all day, which can pull off the imbalance. Other things that can lead to these muscles becoming tight are things like if you've had any chronic infections. Now, that can be, for men, it's not as common to have urinary tract infection, but it can happen. So if you have any sort of infectious process that went on before, okay, whether, like I said, it's a urinary tract infection or other things that then went away, this can actually end up affecting the musculature of the pelvic floor, because anytime there's inflammation within any of the organs, again, whether it's bladder, rectum, or sexual organs, if there's any sort of inflammation or dysfunction that's going on in there, it actually can talk to the nerves around the muscles within the pelvic floor, as well as nerves and stuff around the pelvis, the abdomen, the back, and the hip. And then those muscles become problematic. And so you can start to see here that there's kind of like this chain effect that ends up happening between the pelvic floor muscles as well as all the other muscles around the pelvis and then the low back. Now, within the pelvic floor musculature is a group of nerves. Now, again, this is not for all of you, but there is a group of nerves that actually goes through the pelvic floor. And you can see here that there is this like yellow type structure. If I can get some clarity here, you can see that there are these kind of yellow branches. These are nerves, and they can actually penetrate through your pelvic floor. They do penetrate through your pelvic floor. These nerves actually come out of your spine. So they can go through the pelvic floor musculature. And if these muscles are tight, then they can also compress on some of these nerves, giving you kind of this nervy sensation that can also develop. So I hope all of this is making sense. Now, what do you do about this if this sounds like, yeah, this might be me? I am feeling some tightness within the pelvic floor. I have noticed that before I had this, and now after the vasectomy, things have just gotten a lot worse. So if this is you, then this solution, it seems very simple. Release these muscles, these tight muscles that are within the pelvic floor, as well as all of these other muscles that surround the pelvis and the low back and the hip that may also be throwing things off balance and off alignment, leading to pelvic floor tightness in here. Then it makes sense that if we release all of those tight muscles, then you'll get back to a better balance. You'll get better blood flow through these muscles. If you get better blood flow through these muscles, then they'll hopefully stop compressing on some of these nerves and causing nerve irritation. And so, yeah, sounds simple, right? Well, it is a little bit harder. So it's not like, oh, do this one exercise and everything is going to get better. And I know there's lots of like YouTube things out there and they might be helpful. But if you're really looking for a solution, if you're really looking like, hey, I want something comprehensive, I'm tired of this, what do I do? Then we actually created, a couple of years ago, we created an online program in response to COVID because a lot of people couldn't come in to see us. So that had such a great response and we were able to help so many people just through a simple online program that we ended up developing it into a much more detailed online program that you can do yourself at home. And that link to that online program that is specific to men is actually in the information box below. And that link, once you go through it, you also have the ability to have an online consultation with us where we can talk to you for an hour just about your history, what's going on, and really kind of get a little bit more detailed about what you can do yourself and what are possibly the next steps, because sometimes it's just this that you need and other times you might need some more guidance to help actually talk to your medical providers on what to do. So if you're just looking for a consultation, that link is also down below. And so our online program takes you through 40 videos. It's meant to be done over 6 weeks. It has helped a ton of people. There is a money back guarantee if you use it and you're feeling like this isn't helping me. So you can't lose. So if this video connected with you, it's making sense and you want to do something right away, then you know what to do. But if it also was helpful and you're looking for other videos, we have tons of other videos that you can also look at, but please share, subscribe, and definitely comment down below because we do look at all of these comments and we try to create other videos based on your questions. So I hope this was helpful. Have a wonderful day.